Hi, I am Jin-ha Yoon. I work for Yonsei University College of Medicine. My major is occupational health. I am very happy to discuss the occupational health system in Korea. Today I will talk about the fundamentals of occupational health, and will introduce the occupational health system in Korea. Let's start. This chapter is fundamental of occupational health. What is occupation? Jobs provide the most legitimate way to acquire the resources to keep the quality of life. However, excessive labor inevitably deteriorates health. Illness can deteriorate quality of life. Therefore, we must think of labor and health together. That is why occupational health is so important. Let's summary the key concept of occupation and health as following box. Occupation and health. Jobs, or works, they do to earn something for maintain quality of life. Sometime, the unsatisfactory work environment can disrupt the quality of life. We need the balance between working of job and maintain the quality of life. There are many factors that determine health, the health care issues themselves, and formal and informal working conditions, laws, institutions, and programs are interconnected and affect the health of workers. Now we will discuss that. Health. The World Health Organization, WHO, in its 1948 charter, defined health broadly as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The ILO Occupational Health Services Convention No. 161 defines occupational health services as services entrusted with essentially preventive functions and responsible for advising the employers, the workers, and their representatives in the undertaking on the requirements for establishing and maintaining a safe and healthy work environment that will facilitate optimal physical and mental health in relation to work, and the adaptation of work to the capabilities of workers and the right of their state of physical and mental health. Right and duties. Hence, there are rights and duties among government, employer and workers. At first, let's talk about workers' rights and duties. It is increasingly recognized that the protection of life and health at work is a fundamental workers' rights. Furthermore, workers have a duty to take care of their own safety, as well as the safety of anyone who might be affected by what they do or fail to do. Let's summary the key concept of workers' right in the following yellow box. Workers' right to adequate acknowledgement for worker-place environment and their health, can SOAP work, in the case of immediate danger to safety or health, understand occupational risk and dangers. Let's talk about employers' responsibilities. Employers are well informed about occupational hazards and have a responsibility to promote safety and health in the workplace. Employers must have first aid facilities and various programs to prevent and promote safety and health. A training program that goes beyond education for safety and health is an important responsibility of employers. Employers are also responsible for the rehabilitation, compensation, and return to work of sick workers. Government's duties. The government must ensure health protection activities between employers and workers. To do so, governments are responsible for making policies and monitoring activities. Policies must be enacted and enforced by the government. The government commits to a collective agreement of social partners. Government should monitor your social activities by regularly reviewing the regulations. Worker health surveillance systems are critical to identifying vulnerable occupations that require protective measures. There are three objectives: promotion of workers' health and working capacity, improvement of work and working conditions so that they are conducive to safety and health, development of work organizations and preventive safety and health cultures. According to Occupational Health Fundamental, we regulate the occupational health system in Korea. Occupational health has three main organizations: Ministry of Employment and Labor, MOEL, Korea Occupational Safety and Health Agency, KOSHA, and private organizations. Occupational health system activity. The occupational health system, OHS, in the workplace has legally required activities, such as health management, medical checkup, Environmental check. Like this. Gatekeeper of OSH and private system. The gatekeeper of OHS, a health officer, in the workplace is in charge of OHS activities in the workplace. However, health officers in the workplace are not expert in all of the activities, so they need help from outside of the workplace. They need a private system to conduct the OHS activities. So, the box are extended to private system as following. Private systems support medical health examination, counseling of health management, and environmental check activities. Hospitals and other institutes can act as a private system of occupational health, environmental check and medical health examination. There are red circle of medical checkup and environmental check as the activities of occupational health system. The starting point is environmental check. We measure the working environment in our workplaces every year. Select substances generated during direct handling or use in the workplace, such as noise, heavy metals, and organic solvents. Substances to which workers may be exposed thereafter are measured annually. If the exposed material exceeds the control threshold, the measurement period is shortened and multiple measurements are taken. There are management standards according to measured values, and environmental improvement projects are implemented when the concentration of hazardous substances exceeds the management standards. Special health examinations are conducted for workers exposed to hazardous substances. Special health screenings focus on health problems known to be associated with each hazard to which they are exposed. For example, blood tests are done on workers exposed to benzene, because benzene is known to cause leukemia. Hearing tests are done because exposure to noise causes noise-induced hearing loss. If the health checkup results do not meet the management standards, intensive follow-up management begins. In addition, the health checkup cycle is shortened and early management begins. Workers who are not exposed to harmful substances perform general health checkups and health management to prevent the occurrence of chronic diseases. The last activity is health manage. Health management is related to the result of medical checkup and environmental check. After the special health checkup and work environment measurement, a plan for how to manage the workplace is established according to the result report. At this time, the health manager performs continuous activities to protect the health of workers. For detail, let's look at the pictures. Health management includes medical practice for workers, epidemiological survey and control for occupational disease, walk-through inspection of the workplace, and keeping records related to worker health and workplace monitoring. Health management also have related to role of industrial hygienist, such as evaluation of ventilation system, engineering control of work process, selection of protective devices, management of work environment, and provide material safety data sheet, as look like following pictures. Supporting and research system. Let's move on other institute. Please think about the situation. If there are new occupational hazards or new risk factors which are unfamiliar to the private system, we need new research and protocol to manage the new occupational hazard. In that time, we need a research institute and supporting institute, the name of Korea Occupational Safety and Health Agency, KOSHA. KOSHA also has Occupational Safety and Health Research Institute, OSHRI, and the support health officer in workplace and occupational health expertise in the private system. Please look at the following box. Again, I added KOSHA. We can also see the KCOMWEL, Korea Workers' Compensation and Welfare Service. KCOMWEL regulates workers' health compensation insurance and implements industrial accident insurance compensation. Those are related to the service delivery system of occupational health. Now, I can figure out the occupational health service delivery system. Let's move to administration system. The administration role is one of the important responsibilities of the government and Ministry of Labor. Let's look at the following box, their Ministry of Labor on the left corner of box. The Ministry of Labor plans centrally, and local governments carry out management, inspection, instruction, monitoring, and development. The role of Ministry of Labor is keeping good cycle among government, kosha and workplace and private system. That is, the Korean, occupational health system. In summary, let's review the header of manuscript. We discussed about fundamental of occupational health, and talking about health definition of WHO and ILO. There are right and duties among worker, employer and government. According to that, occupational health system has a cycle among worker, employer and government. There are gatekeeper of OSH, and the activities start from environmental check, medical checkup to health management. The supporting, research and administration role are very important, not responsibility of government. Thank you for listening.